It's been a minute, man. Big Money Bound TV, RRT Posse, YouTube. If you're new to the channel, please like, subscribe, and turn on post notifications. I release scheduled videos every Monday, 12 o'clock a.m. Eastern Time. But I also produce a lot of unscheduled videos throughout the week. So to miss none of those, post notifications gotta be turned on. Now, if you're returning, hey, welcome back. I appreciate all the support. I hope everybody is safe. With that being said, today's video is from a subscriber whose name is, hold on, bear with me. I'm new here, bear with me. Live, Love, Laugh. And they said, could you make a video to uplift the spirits of us RT students that haven't been inside of the hospital since this started? It's gonna be kind of tough to uplift the spirits, knowing how bad the situation is, but I can try to spread some light in the dark area, you feel me? So I'm gonna try my best. We're having online school and we don't have the lab or material to be the best. I know that they are protecting us, but it doesn't take away from how depressing it is. I feel you on that, man. We won't be able to work on a student license either. There's a student's license that you can work on, that you can work under. There's a certain kind of license that a student can get. Can you guys please drop them comments and clarify that for me in the comments, please? Because that's new to me. They should make second-year students nail jockeys and let the professionals focus on patients. Hold on. This will decrease the rate of transmission and help pre-corona overworked and understaffed departments. Y'all keep watching, please. Please keep watching. Let the second-year students be nail jockeys. The hell is a nail jockey? What we represent, man?
Big Money Bound.
Say, let her know, man.
Big Money Bound.
All right, man. So first things first, I feel very, very, very bad for all the second-year students because I'm hearing things like they're canceling the graduation ceremony for the second-year students. Man, like, bro, I apologize for that. And I'm sorry to hear that, bro, because that graduation ceremony is like a huge, that's the final nail in the coffin that like you done with it. You ready to, feel me, really live and rise to the occasion. That's that point where you're finna transcend to become a real deal professional respiratory therapist. Your family there screaming, taking pictures, your cap and gown. Like, bro, I remember I was, like I said, man, they said there was only three graduation tickets per graduate, per person that was gonna graduate. What? I went to every Palm Beach State College campus in my area, grabbing up 12, 14, 15 tickets. My whole family is gonna celebrate this accomplishment with me. Where we from, man, this is rare. That's not allowed, I don't care. This is rare. So, hey, man, I can just like, I don't know what, like, what do I say about, what do I say that can uplift somebody on it? How? Like, how? All I can say is, man, that, bro, like, I'm sorry, like, just try to keep your head up, you know, man, like, just, hey, man, that's messed up, bro. That graduation ceremony, that mean a lot, man. I'm sorry to hear that. You know what that meant? Man, this damn coronavirus. Man. But with all this going on, you gotta like try to find like this could be like a blessing in disguise, man. Like during this time, this is a time where you want as limited amount of people in the hospital as possible because that limits the chances of them being exposed to the virus that's going on, this whole outbreak, man. So we gotta keep the students safe, man. The students are the future, like, so we gotta protect the future, man. No matter, I don't care how old you is, like, you the future, man. You the future, so we gotta keep the future safe. Like you at home with your family. Lord forbid you come in here because you know you want to go to your clinicals, you want to still be getting your hands on learning. and you take that back home, and now you expose everybody in your household. Like, come on. Ain't nothing more important than family. Don't forget about your family. Just think about your family. When you get down and upset, man, I want to think about your family, dog. I want to have my ceremony. Hey. And that ceremony, it's like 4,000, 5,000 people in there, dog. Out of 5,000, somebody got it. Out of 5,000, somebody gonna have it, dog. Hey, do you want to be in there with them? Wearing only your cap and gown? Come on, man. Like, it's a blessing. All you keep your health is important, man. Just try your best to stay safe. Let all this blow over. Then y'all come back when it's time for y'all to, feel me? Y'all come on back. But with the I know you said you guys are learning. It's been a lot of online classes, and I agree with you. Like, nothing can take the place of like hands-on learning. So I know you probably want to be in your lab, getting out playing with your ventilators, practicing intubation, like practicing ABGs. Like, bro, nothing can take the place of that. Nothing. So that's another messed up situation. Nothing can take the place of that. So I hope that your professors, your program directors understand how important that hands-on learning is. So when everything does blow over, all the smoke clears, hopefully they'll allow you guys at least a month or two to get back into that lab and just go to touching things and just getting back familiar with what you used to do. Because even me being a skilled therapist, being a veteran therapist that's been doing it for like 5 years, if I take a week off, I'm gonna have to look at the bin and, oh yeah, okay, you still gotta, like, you feel me, be familiar with it. Because after a week, that's a long time not to be touching no ventilator, man. Now we saying months. So yeah, y'all gonna have to get some lab time, man. So that's gonna be important, some hands-on lab time, man. But I know you said you want to be can the students be like nab jockeys? I don't know, like that's not really that wouldn't be like a very safe idea or good, like in my opinion, that wouldn't be safe or good, because you're gonna like increase the exposure time, your chance of being exposed to a patient that has coronavirus because you're still in the hospital. But no, I'm just doing a breathing treatment to somebody who needs a breathing treatment. But that's how it starts off, man. For an example, let me give you a scenario. Patient comes in with chest pain, just tightness, chest pain, got a little heartburn. He says he got chest pain. Everybody knows if you say chest pain, you're gonna stay over a night in the hospital to get observed. A lot of homeless people coming there doing this, man. Hey, let me get a sandwich and some cookies. Nah, you feel good, go home. I got chest pain. You can't send nobody home that got chest pain. So they're gonna stay overnight if they have chest pain. Now let's say the person that has chest pain, they also have a history of asthma. But their breath sounds are clear, everything is good. They take treatments at home every 6 hours. We're gonna continue those treatments while they're at the hospital. So let's say a student who's a nab jockey, they go in there, they administer the breathing treatment. This patient is here for chest pain. That's nothing with coronavirus. Okay, cool. You get that breathing treatment, the nebulized treatment, aerosolized particles are going within the air. Cool, you in that document chart, checking breath sounds, everything good. That next morning, that patient said, hey, I'm a little short of breath. They check that patient's vital signs. Patient got a temperature of 103. Whoa, they didn't come in with these coronavirus symptoms, but now they're showing up. So now a student has been exposed to possibly the coronavirus until we rule out what's going on. This is happening almost every day inside of hospitals. This virus is like, you don't show symptoms and you can have it. You come in the hospital with no symptoms, an hour later, 2 hours later, you got the symptoms. So it's hard to rule out who. That's why, hey man, address everybody as if they have it. And that's how we're gonna address the people. We gotta keep the future safe, man. I know you want to be in there. I know, man. I know. But what I say, this can be a blessing in disguise. How bad you want to be in there, Randy? I want to get in, I want to grab a nail, I want to put a nail on somebody's head, I want to get treatments, I want to help out during this crisis. Okay, cool. I like your enthusiasm. What I'm gonna need you to do, don't forget how enthusiastic you are right now, how much you want to work, how eager, and don't forget that. Because once you become a therapist, and it's your time to get in there and help and really do the job, it's gonna come a time, it's gonna come a day when you're gonna say, hey man, did I make the right decision by choosing this career path? You're gonna have a day that's so bad, so horrible. A patient was talking dirty to you, nurses talking dirty to you, your director's talking dirty to you, your boss. You're gonna be like, man, what the hell did I sign up for? Don't forget this moment. Don't forget this, because don't forget how bad you wanted to be where you are. But now you're having second thoughts. Trust me, I've been here. I've been inside of the hospital like, man, I went to school for this. I paid somebody to be here. I paid for my education to get here, and this how somebody gonna treat me? I ain't having it. But then I had to remember, respiratory therapy has been good to me. How much it's changed my life. Changed the life of people around me. How much I've changed people's lives that I come in contact with, giving them respiratory therapy care. You feel me? So, hey, man, this could be a blessing in disguise. People, I know I've been in contact with people that's they're having trouble passing the state board exam. Let's say they had passed the state board exam 2 months ago. They'd be employed, they'd be right smack dab in the middle of a pandemic. Widespread coronavirus outbreak, smack dab in the middle. And they only been a therapist for a month and a half. You don't know enough to Hey man, blessings in disguise, man. I understand everybody upset. Let's just, during these times, let's stay strong, man. Let's stay together, RRT Posse. Drop the comments with kind words. How can we get through this together? How can we do some kind of learning situations? And my tips, whatever chapters you have left in your semester, you should know those front and back, have all your study guides made, Skyping, do they still Skype? FaceTiming all your classmates, at least the ones you cool with. I know how that classroom can be. I know how it can be. So at least the ones you cool with, everybody on FaceTime trying to figure out, you got this chapter, I got this chapter, everybody getting the studies right, getting ready for the Kettering seminars, getting ready for the board exams. You got nothing but free time, man. And with that free time, what you can do is, you want to see some you want to see some hands-on stuff, like how you set up an event, how you set up equipment, how you set the settings, blood gas draws. Hey, YouTube, all this. If you can't get hands-on learning, get some visualized hands-on learning, you feel me? And with doing that, you searching YouTube. If you haven't watched all these great big money bound episodes, get caught up. Please get caught up. Come on and get caught up, man. You got the time, just go on and get caught up. Big money bound TV. I appreciate you. Everybody stay strong, stay safe, keep your head up. We gonna get through this. We gonna be all right. Stay safe, man. I'll see y'all next time, dog. That was better?